Hello, I'm Emma Hammett from firstaidforpets.net, and today I'm going to talk to you about the role of therapy pets and how pets make a massive difference to people's recovery in hospital and older people in care homes and older adults generally and children too. How they really do play a role in calming people, in giving people a sense of worth and in helping them recover when they've had an illness. So for a while now, some hospitals have allowed younger children to have a trained therapy dog accompanying them to the anaesthetic room, and that's been shown to calm and soothe anxious patients and make a real difference to how easy it is for them to have their anaesthetic. There's a whole wealth of anecdotal evidence on the benefits of pets on patients, and the Royal College of Nursing has been calling for dogs and other animals to be allowed into hospitals. In 2017, the RCN did a study of over 750 patients, and they revealed that of nurses, and they revealed that 9 out of 10 of them believed that animals improve the well-being of patients with mental health problems such as depression, and 6 out of 10 of them felt the presence of animals in hospitals would speed up their patients' physical recovery. And Amanda Cheesley said that better, more consistent access to animals for all patients who can benefit. The evidence is clear. It will bring joyful moments to people when they're unwell, and the clinical benefits are tangible. Nurses have told us patients with reduced anxiety, patients with access to pets have reduced anxiety, better interaction, and they have a whole reason to live. And we should listen to these experiences. So there's also compelling evidence in a publication called The Economic Impact of Companion Animals in the UK. And basically it's saying that animals are good for people's well-being and mental health, and that pet ownership in the UK may reduce the use of the NHS and have a saving of 2.4 billion a year with reduced visits to the doctor. They've shown that pet owners are less likely to be off sick, which obviously has a major impact to employers and the workplace. That carers are less likely to have to give up work as a result of it, and generally classroom dogs as well have a massive impact on people's learning. So pets, and dogs in particular, have been shown to have a massive economic benefit and a health and well-being benefit to people in terms of calming them, making them have a real sense of worth too. So behavioural assessed volunteer dogs already work in hospices, nursing homes and care homes, and various special needs schools as well. Volunteer dogs are widely used in the community, and they look after people and help them. They avoid loneliness, and they give them companionship, which is incredibly important because a lot of older people feel very isolated, and having a pet, it gives them someone to look after. It gives them a sense of being able to get up and get out, and being able to mobilise and look after their pet properly. So it makes a massive difference to people. There's a Society for Companion Animal Studies which indicates that pet ownership and dog ownership in particular is associated with a decrease in cardiovascular and dementia risk. They say that if you have a patient who's confused and possibly aggressive, if there's a pet involved in their care, that it can reduce that aggression. So it's not only the UK that's saying this. Around the world there's a whole wealth of evidence that if we were to welcome our pets a little more into our caring environments, that the benefits would be massive. So I hope that's helpful. That's Emma Hammett from firstaidforpets.net.